Welcome to Your Health Today. I am Dr. Olaide Jinodun. We'll be talking about hypertension today. What's hypertension? Hypertension is sustained elevated arterial blood pressure of values 140, 90 and above. 140, 90 millimeters mercury to be precise, and above. Okay, what does that mean? The normal blood pressure should be within 100, 120, 60, 80. Now if you notice, we have two values. We have the upper value and the lower value. The upper value stands for the systolic, while the lower value stands for the diastolic. Now systolic is when the heart contracts, while diastolic is when the heart relaxes. So your blood pressure is made up of two values: the systolic value when there's contraction and the diastolic value when there's relaxation. Now what are the causes? Like most diseases, we have a genetic factor and an environmental factor. So if you have it in the family, there's a very high tendency that you come down with hypertension. That is, if you have a first degree or a second degree relative, your mom, your dad, your siblings, your aunt, your uncles, second cousins, there's a very, very high likelihood that you might come down with hypertension. That's one. Two, your diet can actually cause hypertension. When you take a very large amount of salt, your salt intake is very high. Yes, your cholesterol intake is very high. Obesity I'm sure you know about 2-3 people that have hypertension. I'm not talking about people living in denial. Just be very sincere about it. Okay, now what are the common signs and symptoms? Now, hypertension is known for one thing: it's called a silent killer. In this part of the world, especially in Nigeria, when you're lucky to have signs and symptoms, you don't think of hypertension in the first place. You think of malaria, typhoid, because it might come down with headaches. That might just be a subtle warning that there's something happening. Okay, now what are the common signs and symptoms? If you're lucky, you might have headaches. If you're not very lucky, you might have inability to move a particular place. You start to sweat on one side of your face and the other side is dry. These are scary signs and symptoms. Now it will lead me to the complications of hypertension. The reason why this video is very important is because of a common complication: stroke. Please and please, it should be something of the past. Stroke. Why? Because I've come to understand that a lot of us are not very compliant with our antihypertensive medication due to one thing that has been told to you either by your friends, peers, or whatever. But please, we would love you to be compliant. This is for the hypertensives. Be compliant with your drugs. I get to hear a lot of things. I've heard that, okay, fine, doctor, I don't use my drugs regularly because I don't want it to get too low. No, that is why you should have a regular appointment with your doctor. Your doctor will be in the best position to let you know if you are to reduce your drugs, if you have to stop a certain drugs or change a certain drug or change it. Because when you're talking about hypertension, you need to understand how it happens, the dynamics behind it. Now there are two things we think about: peripheral resistance and cardiac output. What does all this thing mean now? Okay, imagine this being your blood vessel. Remember the definition of hypertension: sustained elevated arterial blood pressure. Now imagine this is your artery. Now these are the walls of the artery and there's blood passing through. Now the walls of the artery we'll talk about the peripheral resistance, the thickness of the walls. The thicker the wall or the more resistant the wall, the higher the blood pressure. Now talk about blood volume, the cardiac output. The more the blood that passes through this blood vessel per time, the higher the blood pressure. So if I want to give a patient a drug to bring down the BP, I'm thinking of these things. What drugs will I give to reduce the blood volume? Talk about diuretics. I'm not saying this is for you to go and your doctor must prescribe these drugs. So that's why I'm going to limit how I mention drugs. But I'm just giving you to understand what I'm saying. So that will reduce the volume of blood passing your blood vessel per time. Another one is your ACE inhibitors. You don't need to know what that is. Angiotensin converting enzyme inhibitor. They work at the level of the kidneys. Okay, they protect your kidneys. We have the calcium channel blockers. Those ones reduce peripheral resistance. They allow your blood vessels be malleable, more adaptive to increase in blood volume. So that will reduce the peripheral resistance. You also have many other times, you have the beta blockers and all that, but that will be your doctor's job. I want to be very careful so people don't start prescribing drugs for themselves. I just did that for you to understand very well. Okay, now back to what I was talking about. You need to be very compliant with your drugs, because I've heard a lot of things. I've also heard that, sir, I don't like using this drug because whenever I've noticed that it reduces my sexual performance. Okay, instead of running away from your hospital, from your doctor, go and complain your doctor. Your doctor knows what drugs to stop the moment drugs, antihypertensives, are affecting your sexual life. You have to pick one. It takes you to be alive to enjoy a sexual life. Okay, all right. And some other things that I said. Okay, another thing that gets me baffled when people have hypertension, and the next question is that, what are you thinking of? This person is most likely genetically predisposed to hypertension, so it has nothing to do with thinking. We all think. Now, thinking is not the major cause of hypertension or stress. They are just like risk factors or predisposing factors. They're not the major causative agents. Some people are not even under any form of stress, but the BP is high due to the genetic predisposition. Now, you know what a pressing ion is. Now, imagine a pressing ion which has its regulator, autoregulator spot. That's what hypertension is. Naturally speaking, even if a child runs around a field like 10 times, his or her BP will go up. But without you noticing, the BP comes back down because the autoregulatory mechanisms are still intact. But people that have hypertension have lost the autoregulatory mechanism. So let's stop saying these things that, madam, what are you thinking? Oga, what are you thinking about? What stress? No, that shouldn't be your focus. The focus is, okay, try to calm this person down and place them on drugs and encourage them to follow through. Because if they stop using their drugs, they are candidates for stroke and other complications, kidney problems, cardiac problems, because hypertension is also multisystemic. It can affect the kidneys, can affect the heart, can affect the liver, can affect a lot of organs in the body. So this is not to scare you, but whenever you hear hypertension, don't think it's a death sentence. Please use your drugs regularly. Thank you very much. I would love you to like this video, share your comments, tag your friends, and don't forget to subscribe to my YouTube channel. Thank you.